Vikki Petersen here. I'm founder of Health Now Medical Center, as well as co-author of the book, The Gluten Effect. And today's question that I want to address is from a patient who discovered they were gluten sensitive and wants to know where to start as regards their diet. And I'm going to be doing a two-part series with this one. And today's comment is to the person who's a typical American, and I unfortunately don't use that expression in the kindest of terms. And what I mean is someone who eats out a lot, maybe can't remember the last time they had a salad, and it's just a bit of a junk food junkie, if you will. So I want to start out on a nice, easy gradient for those people who just recently discovered that they can't have gluten and what they should start to do. So the first is removing all gluten, and this is 100%. You cannot cheat. There's not a lot of things in life that are an all or nothing proposition, but gluten is. So you have to be very diligent, really find out where it can sneak in. Our website at healthnowmedical.com really goes into a lot of the places where gluten can sneak into your diet. So get very astute at that and really learn where it is and where it isn't so that you are 100%. Otherwise, you won't get the healing and the restoration of health that you need. In addition to that, I'd like you to go for, as much as possible, removing all dairy products. So I'm talking about milks and cheeses and yogurts and ice creams, not butter. Butter is fine. It's mostly fat, so enjoy your butter. The reason for this is that the damage that occurs to the small intestine of those who are gluten sensitive really prevents them from digesting dairy products efficiently. So when those dairy products are coming in, they're a stressor too. Not to the degree that gluten is, but it's definitely stressing your system. And what we're trying to do is get your small intestine really restored to good health so you're able to take nutrients in and turn them into good fuel and get your health back. So let's get those dairy products as low as possible. That was the two hardest steps. Next is trying to increase your water intake. What's going to happen after getting off the gluten is the body's going to be wanting to get rid of some toxins, and then the more you can hydrate, the better. We're talking about good water, spring water, reverse osmosis, however you want to get it. And you want to get up to drinking half your body weight in ounces of water. So if you weigh 200 pounds, you're going to be drinking 100 ounces of water. And, if this boggles the mind, then just start gradiently and try to increase by a glass a day until you get to that required level. In the beginning, patients complain, all I do is go to the restroom. Well, it doesn't take long to urinate, believe me, it's a good thing. So your body will get used to it and you'll start to crave it. You'll miss it. Every day I come to work with two stainless steel bottles of what I need to drink every day, and believe me, I miss it if I don't get that requisite number of ounces. So that's the next thing I want you to work on. And then every time you eat, I'd like you to definitely not skip meals, and traditionally we think of 3 meals a day as what we need. I'd love it to be 5, but let's start on a gradient and make it 3 to start, so you're not skipping breakfast, and so you're having breakfast, lunch, and dinner, and every time you eat, I want you to have some sort of a good protein, a complex carbohydrate, so that would be fruits and vegetables, and a good fat. So a good fat, avocados, nuts, seeds, olive oil, coconut oil, butter, those are your good fats. Your protein are your eggs, chicken, fish, turkey, lamb, etc. So that's your good protein. We're going to get into the whole quality issue of these foods in the next video, but remember, we're on our baby step video here. So I just want you to make sure that every time you eat, you're getting protein, you're getting good fat, and you're getting a nice dose of those complex carbohydrates, and that's fruits and vegetables. So let's see what else. We want to eat as much as possible real food. So not a lot of preservatives. We can take a corn chip as a good example. So you could buy a corn chip where the ingredients are corn, oil, salt. Done. You could also, I'm not going to pick on any brands here, but you could also get some flavored corn chips where there must be 15 ingredients easily on that ingredient list, many of which you'd have trouble pronouncing. So my rule of thumb is if you can't pronounce it or you don't know what it means, you shouldn't be eating it. So we'll keep it simple with that and try to eat food that's as unchanged from its real state, the way it was produced by the earth, as possible. So that's another good rule of thumb. And it's totally fine to find some gluten-free goodies. So there's gluten-free brownies and cookies, and I mean there's so much out there that never used to be. But let's keep it in moderation. So we don't want to go to a gluten-free junk food diet. What we really want is gluten-free with all the things that I've mentioned thus far. So, you know, if twice a week you have a gooey dessert and you get one of those wonderful cupcakes that they have at some of the grocery stores these days, and okay, fine, you know, enjoy that. But not every day and not twice a day. I've had patients that got off gluten and they started gaining weight because they found so many yummy gluten-free goodies that they went a little bit crazy with it. So don't do that, and I hope this helps. Baby steps, one thing at a time. And remember the first one I mentioned, 100% off gluten. All right, good luck, and until next time, I wish you very good health.